Hi everybody, we're live again on my Fabulous 250. It's seeming like quite a journey and it's already dark here in Cape Town, so it feels like evening but it's still late afternoon. And today we are going to start working on my neck because that's probably when we hit our 50s, the one area that we're really concerned about, and there's many treatments that we can do. So Serena, what are we doing today?
Well, today we're going to do a Nefertiti lift. So maybe Nerine, you could explain to everyone where that name came from.
What is a Nefertiti lift?
Yeah.
Well, if you remember, in the 1300s there was Queen Nefertiti, who was one of the most beautiful queens of Egypt, and she is known for having the most beautiful, defined, elegant neck, and that's what we're going to try and create today. So in simple terms, we are going to be using Botox to try and have a non-surgical neck lift. This doesn't replace any surgery, so don't be under any illusions that it'll be a surgical replacement. But by injecting the muscles in the neck, we basically will be redefining the jawline. And the reason for this is when we look at our necks, we have muscles which actually pull our faces up, and we have muscles that pull our faces down. And the neck muscles, which is the platysma muscle, actually is a very strong muscle. You can see my muscle, like looking really tight, just pulling my whole face down. And by relaxing this muscle, it's like a tug of war which happens. So we'll have the muscles that are pulling up and the muscles that are pulling down. And by relaxing these muscles that pull down, we'll be able to have more of a lift in the neck and the jawline. So that's why when you're going to be injecting all these little injections into my neck, we're going to be creating a more defined jawline, sort of more elegant neck, which I'm looking forward to. The other thing, which is part of the neck, is actually what we call this little mouth frown, the depressor anglioris. And you can see mine's like really strong. I haven't had Botox for ages, and it's now time to be injecting that little muscle. And the same thing, this muscle, the function of the depressor anglioris. So it's the muscle, the depressor, which means depressing, of the anglioris. So it's the angle of the mouth. And by relaxing this little muscle, we're able to actually get mouth corners to turn up a little bit. So hopefully I'll have a little smiley mouth. All right. So I think, Serena, let's continue with our Nefertiti lift.
Okay.
I'm looking forward to be looking like Queen Nefertiti. So I'm going to lie down and Serena's going to get her injections ready. And so that's me lying down. And if you have a look, if I pull down, that's the mouth frown. But what's more concerning are these burns, and these can be quite aging. When we have younger patients, they don't really have these prominent bands, but as we age, we lose a bit of volume in our neck, and that's why we start getting these bands. So Serena's going to be giving me tiny injections, and let's just get the camera right. Which way do you want me?
Yeah, that's perfect.
Okay, so I'm going to like pull down, and then Serena can actually see where, can you see where that muscle is if I go like close?
Hold on.
Where
I can
it's
see
like
it right there.
Okay, so that was the depressor anglioris. So it's that little muscle that pulls the corner down. Now we also have our SMAS, which is sort of the facial muscle, which is connected to the neck muscle. And the same thing, Serena's going to give me two little pricks here. And by relaxing that muscle, we're now going to actually also help to get a little bit of a lift so that the muscles that are actually the elevators of the face will work better and the depressors of the face will actually be slightly more relaxed. So here we go.
Just going to go in deep. And last one.
Perfecto. There we go. Am I still on?
Yep.
There we go.
Data problems.
Mm-hmm.
How are you feeling?
I'm feeling great. It's really painful to be beautiful. Okay. So what we basically now relaxed the corner of the jawline. So that's going to give me more of an elegant, defined jawline. And now it's more about really addressing these muscles that really pull our neck down. And you know what I find crazy actually is that a lot of people do lots of exercises to make these muscles stronger. I don't know if you've heard of that, Serena. You know those exercises where people really try and strengthen their neck muscles. And it's probably the worst thing we want to do because, you know, when we strengthen those muscles, we're actually strengthening muscles that pull our faces down. And in essence, we want them to be relaxed. So I probably wouldn't agree with doing facial neck exercises. I think it's great to exercise the elevators, but definitely not the depressors. Okay, so now we're going to do the neck. Let me see if I can get you guys to see that.
Give me a bit of a pull. There we go. I'm just going to clean along here and pull again there for me. I'm just grabbing that. Pull again. More. Right. And then let's pull over here. Okay, well that one's not very strong, but we'll zap him anyway. And again for me. Perfect.
It's crazy how you know that you can sort of one side, you can see is actually a lot stronger than the other side, and that just happens. You know, sometimes we have stronger sides and not stronger sides. And I must say, look at my face while Serena's getting ready. And I don't know if you read or saw, I had the medical needling about a week ago, and my skin is looking nice and glowy.
It's looking beautiful.
Still a little bit red, if I have to be honest, but it's actually starting to look nice and glowy after my first medical needling session of the year. Okay.
Oh, let's get this back. And pull that for me. Perfect. Quite a strong one. So I'm just going in at right angles into the muscle belly. Quite a strong muscle. And let's go again here. Possibly not too strong there. There we go.
Great. So I'm not sure if there's any questions. I don't know if anyone's actually watching us or everyone's sleeping. But if there's any questions, you're welcome to ask. And as I've mentioned, there's many treatments to improve the neck. It's not just one treatment. So we're looking at muscles, we're looking at quality of skin, we're looking at tightening the area. And it's probably one of the most difficult areas to actually treat. And that's why we need these different modalities. And, you know, some people just have got they've got stronger muscles in the neck, versus other people have got a lot of just softer muscles, where you can see how strong, oh no, that's not very good. So hopefully in a few days my neck's going to look younger. I'm going to have a Queen Nefertiti lift.
Yes.
And maybe I can move to Egypt. Who knows?
And run a country.
And run a country. Serena, so yeah, thank you. I think you probably also see a lot of people with neck problems.
Yes.
And what would your advice be when you see someone with a neck lift? It's probably, you know, a lot of people probably need surgery, hey?
Probably a lot of people need surgery. So when I look at a patient, what I love about the Nefertiti look is the Botox along here, because that just narrows this part of the face. So you look like you've lost a little bit of weight. People have strong jaw muscles when they clench. If you press here and you clench and you feel a lot of strong muscles over here, it can make your face look a little bit rounder and chubbier. That just gives you that elongated, kind of thinner look. So I love that part of the Nefertiti lift. But there is a point that if we're continuing with this and we're not seeing much, we might have to go to an arena and consider some surgical options as well.
Oh dear, so I'm probably one day going to have to go and have my neck lift done. But so far
Your neck's beautiful.
My neck looks great, but I've been working at it and I've been having a few treatments, and my derma pen, I'm not going to show you guys. Maybe I can. You can see here it's still very red from the derma pen or the medical needling that I had a few days ago. So I still have quite a bit of redness, but I know that's going to lighten up. And obviously going to help more with the skin quality, whereas this now is going to help for the muscles. And maybe even I have had Ulthera treatments as well, which also helps to tighten the neck. And that's maybe something I had that about 18 months ago. So I might consider doing that for my 50th as well, just to get really even more of a tightening going. So there's many options before we have surgery, and hopefully I can still delay it for another few years. And so that's us for today. I just want to see any more questions. Gee, no one's actually asking for any questions. Seems like everybody knows everything about the Nefertiti lift. And so that's us for today, and we have a little seat here. So bye everybody.
Until next time.